Pharmacology formative assessment test is which of the following are the characteristics of the drugs having high volume of distribution? If the drug is having high plasma protein binding, it retains inside the vascular compartment only, so it is having a low volume of distribution. Highly lipid soluble drugs, it crosses all the barriers and that's why it is having a high volume of distribution, so it is a correct option. Selective sequestration in the tissues, I have told you that drug crosses all the barriers and selectively sequestered in the tissues, so its apparent volume of distribution is very high. And all of the above, so it's not correct answer. So the correct answers are highly lipid soluble drugs and selective sequestration in tissues. Question 2. Which of the following drugs are produced through recombinant DNA technology? And the options are morphine, insulin, erythropoietin and liquid paraffin. And the answers are morphine is obtained from the plant product, so it is not the correct answer. Insulin is obtained through the recombinant DNA technology, produced through the recombinant DNA technology, as well as erythropoietin, which is used in the chronic renal failure. It is also produced through the recombinant DNA technology. Liquid paraffin, it is obtained, it is a mineral product, so the correct answers are insulin and erythropoietin. In which of the following phase of the clinical trial, primary purpose is to evaluate the pharmacokinetic characteristic of the drug in the human being? And there are 4 different phases of the clinical trial, and dear friends, you know that in the phase 1 clinical trial, we are administering the drugs primarily in the healthy human volunteer around 30 to evaluate the pharmacokinetic characteristics as well as the safety of the drug. Later on in the different phases, we are administering the drug into the patients, and although we are evaluating pharmacokinetic characteristics, but our primary aim is to evaluate the safety and efficacy. So the correct answer is phase 1 clinical trial. Question 4. Characteristics of essential drugs are: it is for the treatment of the disease prevalent in the particular area. Yes, very true. Drug must be cost effective. Yes. Drug must be available in adequate quantity. Yes. And quality standards must be maintained. Yes. So all of these are correct option. Drug must be cheaper. No. Many a times there are chances that the disease is so much prevalent in a particular area, the drug is effective in that disease, but even though the drug is more costlier as compared to the other drugs, but that drug is having a definitely better advantage, and that's why cost effectiveness must be there. But if the drugs are cheaper always, it is not possible. So the correct answer is A, B, C and D, but not E. Question 5. Science of identification of the drug is known as pharmacometrics. No. Biopharmaceutics, it is about the formulation of the drug. Pharmacognosy, yes. And pharmacovigilance, it is about the reporting of adverse drug reaction. So the correct answer is pharmacognosy. Limitation of the oral route of the drug administration. It cannot be effective in emergency. Very true. It cannot be effective when you want a precise plasma concentration. True. Patient compliance is very poor. Wrong. Patient compliance is very good for the oral route as compared to the parenteral route. Costly? No, as compared to the parenteral, because we have to calculate the total treatment cost. In the parenteral route, you all know that the additional healthcare professionals expertise is required, so additional cost will be added. So option A and B are correct option, while option C and D are incorrect. Question 7. Which of the following routes should be preferred for administering the drug for identification of drug allergy? Topical application? No. Intradermal? Yes, we are administering the small amount of the drug through the intradermal route, and then we observe for any local reaction, especially in case of penicillin that we have already discussed. There is no question about transdermal and subcutaneous implant. So the correct answer is intradermal route. Advantages of sublingual route of drug administration are following, except here again you have to select the incorrect option. Rapid onset of action, it is the correct option. Action can be terminated whenever required. You just spit out the tablet, action will be terminated. Lipid insoluble drugs, no, you cannot administer lipid insoluble drugs. First pass metabolism can be bypassed. Yes, drug directly enters through the buccal capillaries into the systemic circulation. So first pass metabolism is bypassed. So the correct answer in this case is lipid insoluble drugs can be administered, because it is you have to administer only and only lipid soluble drugs. And always note down here the question has been asked except. So you have to select the disadvantage. Okay. Then question 9, which is the most suitable method of intravenous administration when you require immediate high plasma concentration? Bolus, injection, infusion, or any of the above? When you require a high plasma concentration, rapid administration of high amount of drug is administered and it is known as an intravenous bolus. So the correct answer is bolus. Then possibilities after biotransformation of the drug is conversion of the active drug into the active metabolite, yes. Conversion to inactive metabolite, yes. Conversion to both active as well as inactive metabolite, yes. And conversion of inactive to active drug, yes. So the correct answer is, all are the correct answers. Then therapeutic index is a measure of, it is calculated by LD50 upon ED50 and it is a measure of the safety of drug. More the therapeutic index, more the safer is the drug. Amount of the drug required to produce a desired action is known as safety, efficacy, potency, and none of the above. The correct answer is potency. Potency means it is the amount of the drug required to produce a particular action. Okay, and it is a relative term. Fastest onset of action is observed with, there are different receptors. G protein coupled receptor, the drug binds with the receptor which is attached to the G protein. Then there are series of first second messenger mediated reaction and then the action is produced. Ion channel receptor, drug directly binds with the ion channel mediated receptor, channel open closes and immediate action is the seen, and that's why the fastest onset of action is seen with ion channel as compared to other transmembrane enzyme linked and receptor regulating gene expression. Here I want to tell that if someone asks you the slowest onset of action is observed with, the answer is receptor regulating gene expression, because here there is a synthesis of the protein and this protein will act, and that's why the maximum time course required is with the receptor regulating gene expression. But here the question is fastest onset and the answer is ion channel receptor. Then question 14, which of the following characteristics is or are responsible for nil oral absorption of drug? Poorly lipid soluble drugs, obviously its absorption is less, but nil, it is not the correct answer. Strongly acidic drugs, yes, these are not at all, they are highly ionized drugs, not at all absorbed. The classical example is heparin. Poorly water soluble drugs, again the absorption is there but less. And the drugs that are neither lipid soluble nor water soluble, again that is responsible for the nil oral absorption, and that's why the correct answer is strongly acidic drugs and neither lipid soluble nor water soluble drug. Question 15, salbutamol is not effective for the long-term management of the bronchial asthma because poor patient compliance, no. Upregulation of receptors, no. Down regulation, yes. And what is tachyphylaxis? It is an acute development of tolerance. Here in the case of the salbutamol, what will happen that when you chronically, because salbutamol is a beta 2 receptor agonist, when you continuously stimulate the receptor, what will happen that after a certain period of the time, the receptor sensitivity reduces, there will be internalization of the receptor, and that's why the drug is not going to be effective, but on a long term, and that's why the correct answer is down regulation of receptor. Then the most vulnerable period during the pregnancy as far as the teratogenicity is concerned is initial 2 weeks, fertilization and implantation, 17 to 56 days. This is the period of the organogenesis. Then 3 to 6 months, the period of the growth and the development, and all of the above. So teratogenicity, it means drug induced structural malformation. So most vulnerable period is the period of organogenesis, and because of this the correct answer is 17 to 56 days. In hypodermoclysis, large amount of the saline is administered in the pediatrics. Okay, and it is the options are intravenous, intramuscular, subcutaneous and oral. And the answer is many times in the pediatrics it is difficult to assess the intravenous line, in which in that case the saline is introduced subcutaneously in the large quantity, that is known as an hypodermoclysis. Then maximum volume of the drug is administered by intradermal route. Very less amount of the drug is administered in between the layers of the skin. Intramuscular up to 10 ml. Intravenous route you can administer as much amount as possible, and intra-articular route again a very small amount. So the correct option is intravenous route. Now here you have to identify the dosage form or the drug delivery system. Here you can see a transdermal patch which is used for applying to the skin. So drug is released slowly over a period of the time and produces the action. The examples are hyoscine. Then here you have to identify the type of the tablet. Here you can see that after the tablet is administered in a glass and it is disintegrates, and you can see the bubbles of the gases are produced, and that's why it is an effervescent tablet. Okay, thank you.